Today I'm talking about memory interventions and cognitive rehabilitation. So I just want to introduce the three types of memory. There's short-term memory, holding limited information that is very accessible. Working memory, it's used to plan and carry out behaviors. And long-term memory, that is memory that gains stability over time. In memory, encoding of new information can be the result of damage to the hippocampal system or frontal lobe affecting attention. Word and information retrieval impairment is often linked to frontal lobe injury, which affects organized searches of information. In memory interventions result in positive outcomes in therapy, so that is the good news. Strategies and interventions can consist of process interventions like errorless learning, space retrieval therapy, or categorization. Internal procedures are things like self-questioning, what am I supposed to be doing? And external procedures are lists and calendars, something that a patient could use to help them stay organized. So when you work with patients in the area of memory, you want to start with the patient interview. And in the patient interview, you want to determine what the patient is using successfully already in the area of memory. You want to obtain a family perspective on status of the patient's memory, because sometimes they do have a different perspective than the patient does. And it's very valuable to start with that. You want to scaffold the patient with compensatory strategies. You want to work to build memory aids into the patient's routine ultimately. And you want to use equipment and familiar processes, something that they're familiar with already. If they use technology, you can help them think about ways that they can use apps to help them improve storing information that's important for them to remember. And also, the most important thing is to go to the evidence, make sure that you're using evidence-based practice. And I highly recommend the American Speech and Hearing Association's practice portal that has literally evidence-based practices on all of the different interventions that you might use, as well as it's also categorized by disability types. External procedures are important to work with the patient on, and some of them would be in terms of working with retrospective memory, using recording devices to record important information. For example, journals and recorders and perhaps computers. Also, prospective memory aids would be post-it note, the little square pads, calendars, reminder apps on phones, alarms on phones to remind of appointments. Also, encoding, to help them encode, would be to ask them to self-question, do I understand? And if so, they would repeat. If not, ask a person who they're talking to repeat. So that would just be a procedure that the patient would be using on an ongoing basis when they are talking to another person or are learning new information, perhaps from something that they're listening to on television. They can just replay something if they're able to have the technology to replay it. Also, they would label where to keep items and to be consistent. So that's another external procedure where they would just label where to put their keys, their glasses, their wallets, their purse, and just literally have a label of where those areas are, and then that would just be their cue to remember to put items in those places consistently. Also, other procedures that would be important in thinking about therapy is helping patients understand that it's good to set larger goals over time for them to achieve, for them to self-instruct. What am I supposed to be doing? For example, they can place an index card throughout their house with just that one question on it, which would be something that you would train them in how to think about answering that question throughout the day to help them stay on task and to remember what they're supposed to be doing. Also, rehearsing important information that might be coming up. They might have a meeting with a group of people and they might want to rehearse the names of the people who will be there. Also relating information to their personal life, information that they're having to remember, having it relate to something that's meaningful to them. Visualizing the main idea of information, and then also when recalling information, when they're trying to remember something, try to picture the location that they actually remembered the information in, where they actually learned about the information, to think back to that environment and that would perhaps help them. The goal there would be to help them cue themselves to remember the information better. So some important memory interventions are visual imagery, semantic association, chunking, space retrieval, and errorless learning. Those are all evidence-based practices that you can use to help patients. The patients that we're talking about have mild cognitive impairment. These interventions can also be helpful for patients who have major cognitive impairment but who are in the beginning stages of that. Intervention strategies, additional intervention strategies to the ones that I just mentioned would be self-questioning, first letter mnemonics, chaining, word pairs, including synonyms and antonyms, and sentence completion tasks. So word finding is an area that many patients complain about in the memory space. Like if a person is saying that they're having problems with memory and you ask them for an example, and when I say a person, I mean a patient, oftentimes they'll say, I just can't find words, it's on the tip of my tongue, or something of that nature. And so that's where word finding techniques and strategies come into play that can be very helpful in helping them in the long run recall words. An example would be describing items in an organized way. So they might not think of a word, but they can describe the word that they're thinking of by using an organized, in my case, I use a mnemonic, CAFALD, pronounced CAFOLD, that patients remember, and that stands for, it's a mnemonic that stands for category, action, function, association, location, and description. And with each of those words, the patient describes that feature about the word that they're trying to recall. In addition to that, patients can search their memory using a semantic feature analysis. They can ask themselves questions. What kind of thing is it? What does it do? What is it used for? What are its attributes? Where is it found? And what do I associate it with? And so that's something that they can internalize over time. That can be printed out on a card that they just have around their home environment, that if they have a hard time finding the word, they can look at that card and use that as a cue to help them think about those features of the word. That serves two purposes. It helps them describe it to their communication partner and helps them actually achieve the communication of what they're trying to say. And it also helps them improve being able to recall the word. That kind of therapy does generalize to other words. So it helps the brain functioning in terms of opening up the neural pathways that would allow them to more likely recall a word later in that semantic way and categorically. Addition to that, in an area of word finding, a patient can self-cue with a phonemic cue, so they can go through the alphabet. This is more likely relevant if someone's thinking of a proper name of a person than just other types of words, so that's something important to remember. Also, they can think of the opposite of a word and then the opposite of that particular word. So it's like thinking of an antonym and then thinking of the opposite of that antonym to help get them back to the original word that they're trying to think of can be helpful. Brainstorming words with writing them down is helpful because it helps them, it accesses the written pathway in the brain to help. Sometimes that can cue a patient to think, oh yeah, that's the word that they're looking for by seeing certain letters that they're thinking of. And then they can also associate physical characteristics of a person with their name. So that's just if a person has a problem thinking of a name of a person, they can try to think of maybe the physical characteristic that they thought of when they encoded the word in the first place. Also, they can use gestures and signs. They can use a carrier phrase like I drive in a blank. Like, again, they're having trouble thinking a word. This is what you're using in therapy. So you're just giving them a carrier phrase to help cue them to think of the word that they're trying to say. Also, you can have them try to write the word out, and that can help them sometimes think of the word, just like I was just saying earlier. So a cueing hierarchy is also very important in therapy. Think about how you're cueing a patient, and doing it consistently is helpful for actually giving them, modeling for them how to think through finding a word when you're not there. So first you want to impose a delay or have the patient request more time. You can provide a semantic cue related to the word you're trying to get them to remember. So you can say chair for the target word couch, for example. You can provide a phonemic cue after that using the sound of the beginning sound of the word you're trying to say. So something like ba for ball. You can provide a description of the word, and after that provide a carrier phrase for the target if they have not figured out the word by that time. Carrier phrase like I play and blank when you're trying to get them to say, for example, the target word instrument. So if maybe a patient is trying to think of an instrument that they played when they were in high school, and you think that's the word, and you can give them that cue with a sentence. And a therapy tip is to collect some type of quantifiable measure of a patient perception of their memory right in the beginning, so that you do have something to compare it to when you're finished. There are many books that have different simple surveys that you can give the patient to fill out, and you can also have them take it home. There might be, it's also helpful to have a reporter, like a spouse or a family member, who can also fill out a portion of that survey or their own version of it. I find that very helpful. And it's something that I do in the beginning and at the end of therapy to compare patients to determine if the patient thinks that they've done better with some kind of quantifiable measure. I also recommend determining what type of memory you're working on to better target memory. So decide if you're working on working memory, if you're working on short-term memory, or if you're working on long-term memory, so that you can specifically put that into your goals. So that's something that you're going to be able to go back to at the end of your therapy interval to determine if that specific memory has improved. It also helps you when explaining to the patient exactly what you're working on. So I want to thank you very much for watching today. I hope that you have been able to glean something from these recommendations, and please share with me if there is some type of interventions that you use to help patients improve their memory. Thank you so much for watching.